Welcome to This Explainer. Bringing a newborn into the world is just absolutely magical, isn't it? But let's be entirely honest for a second. Along with all that magic comes a massive, sometimes totally overwhelming sense of responsibility. Suddenly, you're completely in charge of this tiny human, and well, they don't exactly come with an instruction manual. So consider This Explainer your modern survival roadmap. Today, we're taking the latest evidence-based pediatric guidelines and translating them into a super clear, practical guide that will walk you right through the essential first steps of newborn care.
Now, if that question is making you nod your head, I want you to hear this loud and clear. You are not alone. It is completely 100% normal to feel intimidated by the unknown. Will you know why they're crying? Will you know if a random rash is normal or dangerous? Well, take a deep breath. By the time we finish up here, you are going to feel so much more empowered. You'll know exactly how to spot the difference between completely normal everyday newborn quirks and genuine medical emergencies.
So, here's our game plan. We'll start with our early days in hygiene, move into feeding and safe sleep, and cover those moments where there's no need to panic. Then, we'll quickly pivot to the red flags you can't ignore, bust some dangerous myths, and finally, wrap up with the absolute importance of maternal mental health. Let's get into it.
All right, Section 1, Early Days and Hygiene. The moment your baby arrives, getting that immediate, uninterrupted skin-to-skin contact during the golden hour is absolutely vital for their heart rate, their breathing, and building their immune system. Now let's talk about the umbilical cord, because modern medicine has radically changed how we handle this. The golden rule today is dry care. You might have a well-meaning relative telling you to wipe the stump with alcohol or green dye, but science actually says no way. That actually delays the healing process. Just keep it clean, keep it completely dry, and here's a pro tip. Always fold the diaper below the cord. You want it getting plenty of air so you don't run into infections like omphalitis. Bath time! When it comes to bathing your newborn, less is definitely more. You want the water at a perfect 37 degrees Celsius, that's about 98.6 degrees Fahrenheit. But here's the kicker, please don't overwash them. Scrubbing them with soap every single day just strips their super delicate skin of its natural oils, which leads to severe dryness and nasty diaper dermatitis. You only need soap 1 or 2 times a week. And if they do get diaper rash, the absolute best cure is a 10 to 15-minute air bath. Just let that skin breathe, diaper-free. Moving on to Section 2, Feeding and Safe Sleep. When we talk about feeding, remember that breast milk is quite literally liquid gold. It is packed with immunoglobulins that act like a protective shield for your baby's brand new immune system. Now for sleep. We need to build what we like to call a safe fortress. Safe sleep isn't about making the crib look cozy. It's about preventing sudden infant death syndrome, or SIDS. The rules here are incredibly strict. Your baby must always be placed flat on their back to sleep. The mattress has to be firm. And the crib? Completely empty. I mean it. No cute pillows, no thick blankets, no plush toys, nothing. Also, keep the room nice and cool, ideally between 20 and 22 degrees Celsius, to make sure they don't overheat. After feeding, a lot of babies are going to spit up. Seeing 1 or 2 tablespoons of milk slip out is totally normal. It's called physiological spit up. Mostly because the muscles at the top of their tiny stomachs are still pretty weak. But you need to contrast that with what we call fountain vomiting. If your baby forcefully shoots vomit out like a literal fountain across the room, that is a massive red flag. Okay, on to Section 3. No need to panic. Newborn bodies go through some wild, sometimes terrifying-looking changes as they adapt to life on the outside, but most of them require zero medical intervention. A really perfect example of this is jaundice, that yellowing of the skin and eyes. Using our red flag rule, we can easily separate what's harmless from what's dangerous. If that yellowing shows up on day 2 or 3, it's usually just physiological jaundice. It's safe, their little liver is just playing catch-up. But if the yellowing appears on day 1, or if it rapidly spreads all the way down to their palms and the soles of their feet, that is pathological jaundice, and it requires immediate bilirubin testing by a doctor. You are also going to see some crazy skin changes. Melia are those tiny white bumps you might see on their nose. Baby acne literally looks like teenage breakouts, and toxic erythema, that looks like angry, bright red patches. Listen to me, do not panic. These are just temporary reactions to the outside world, or just mom's hormones leaving the baby's system. The treatment? Absolutely nothing. Don't squeeze them, don't buy fancy medicated creams, just keep the skin gently clean and they will clear up on their own. Another major panic moment usually hits around the 3-week, 3-month, and 6-month marks. It's called a lactation crisis. Suddenly, your baby seems absolutely starving, and mom feels like her milk supply has just completely vanished. The experts strongly advise mothers not to instantly abandon breast milk for formula during these spikes. Usually, it's just the baby hitting a massive growth spurt. The fix here is more frequent feeding, which signals the body to make more milk and making sure mom gets some well-deserved rest. All right, shifting gears to Section 4, emergencies and red flags. While we just talked about what's normal, these next items are genuine medical emergencies. These are the skip the clinic and drive straight to the hospital moments. Remember that fountain vomiting we mentioned a minute ago? Let's double down on that. If your baby is forcefully vomiting after every single feed and they aren't getting any weight, this could be a condition called pyloric stenosis. Basically, the valve from the stomach to the intestines has thickened and closed up. This is a critical surgical issue and time is absolutely of the essence. Next up, respiratory red flags. Listen, newborns don't just get a simple cold. If your baby is taking more than 60 breaths a minute, if you see their nostrils flaring wide open with every breath, or if their chest is sucking in deeply right under their ribs, get help immediately. Even a basic cough in a newborn can rapidly snowball into pneumonia, purely because they just don't have the muscle mechanics to clear their own lungs yet. To manage the minor stuff at home, you need a proper newborn first aid kit. The sources are clear. Get a good electronic thermometer. Please, throw out those old glass mercury ones, they are way too dangerous. Keep saline drops on hand for stuffy noses, have baby-specific paracetamol or ibuprofen, and only use doses prescribed by your doctor based on the baby's weight. And please, hear me on this one. Aspirin is strictly prohibited for babies, period. It can cause a fatal condition called Ray's syndrome, which leads to severe liver and brain damage. Which brings us to a massively important preventative measure. Right after birth, the hospital will offer a vitamin K injection. Why? Because babies are born with incredibly low levels of this vitamin, and they need it for their blood to clot properly. Without that shot, there is a hidden, sudden risk of hemorrhagic disease. We're talking catastrophic bleeding into the brain or from the umbilical cord. This injection isn't an extra. It's a critical, life-saving safeguard. Section 5. Dangerous myths and traditions. Brace yourselves, because as new parents, you are about to receive a mountain of unsolicited advice. We've got to separate the harmless traditions from the stuff that actually goes against modern medicine. Let's look at swaddling. For generations, people swore by soldier swaddling, wrapping a baby's legs super tightly together so they grow up with straight legs. Modern orthopedics tells us this is highly dangerous. Forcing the legs straight disrupts how the hip socket forms and directly causes hip joint dysplasia. The safe, modern way is free swaddling. You can wrap the arms up, sure, but those hips and legs need free movement in a natural, frog-like position. And there are a few other harmful myths we need to bust right now. First, do not add salt to their bathwater to toughen up their skin. A newborn's kidneys literally cannot process the salt absorbed through their thin skin. Second, do not drip breast milk into an infected ear or stuffy nose. Breast milk is full of sugars and acts like a petri dish for dangerous bacteria. Finally, don't cover the baby in thick sheep fat. A baby's skin has to breathe to regulate temperature, and thick fats just cause severe overheating. Finally, Section 6, maternal mental health. We've spent a lot of time talking about the baby's physical health. Now let's take a deeply empathetic shift and talk about mom. Those first 3 months, they're often called the 4th trimester. Mom's hormone levels are completely crashing and the sleep deprivation is relentless. It's a brutal combo that frequently leads to postpartum depression. And it creates this interconnected loop, right? Maternal stress produces cortisol. That cortisol transfers into the breast milk and it directly impacts the baby, often making them way more irritable and prone to colic. So if you take one thing away from today, let it be this. A happy mother means a healthy baby. Taking time for self-care, asking for help, actually sleeping when the baby sleeps, these are not selfish acts. Prioritizing a mother's mental and physical recovery is the absolute, non-negotiable foundation of the baby's long-term health, period. I want to leave you with a provocative question to chew on. How will you support a new mother? If you're a partner, a friend, or a grandparent watching this, I challenge you to step up with active support. Bring over a hot meal, hold the baby so mom can take a nap, and please, withhold the unsolicited, outdated advice. Let's empower parents with modern knowledge and genuine empathy. Thank you so much for joining me on this deep dive into newborn care. Keep exploring, keep learning, and you've got this.